So yesterday we talked the topic the eyeball. So basically number of things are completed. So we are talking about the retina. Okay. So let's start with the retina. Very important. Okay. Without retina, we are unable to see the things, whatever wonderful things are present around us. The retina lines the posterior two-thirds of the eyeball. So basically, so what is retina? Let's see the in this image. I think it's not given. Yeah, here it is given microscopic retina. So first we will see the image. Okay. So basically this layer is nothing but retina. Okay. This is the retina. This layer. This is the vitreous. In the eyeball we have liquid. This is the lens. This is the pupil. This is the cornea, ciliary body, choroid. Okay. Optic nerve, sclera, and retina. The most inner layer from the posterior view to anterior view. Okay, like you can see that this is the retina. Okay, whole covering. Okay, so let's talk about that retina. So the retina lines the posterior two-thirds of the eyeball and contains the visual receptors. So the main things which are present on the retina, that is visual receptors. So without receptors, the information, whatever information of vision is not able to enter into the eyes. So receptors will receive the information of vision. Okay, then only the pathway will start from that area. Okay, so how the visual receptors are seen in the shape of rods and cones. So you can see that this is the cones, like we have ice cream cone. You can see. So this is the cone. Okay, and this is the rod-like structures. Okay, this is the rod-like structure. Okay, so this is how the retina looks like. So what the rods and cones do? So rods detect only the presence of light. So what rods can do? If there is only light here, so rods will detect, yeah, this is there is light here. Okay, and the what will cones do? Cones will detect the colors, which, as you may know from physics, are the different wavelengths of visible light or raw. Okay, so basically cones, what will they do? They will detect the colors of the particular things which are present in your surroundings. So I am looking to my laptop. I am teaching you. Okay, so what will the first the rod will detect the light and surrounding I have light. And second thing, the cones, the whatever visuals are entering into my eyes. So the rods will detect the light. The cones will detect the color of the surroundings. Okay, rods are proportionally more abundant towards the periphery or edge of the retina. Our best vision in dim light or at night, for which we depend on the rods, is at the sides of our fields, visual files. Cones are most abundant in the center of the retina, especially are called the macula lutea, directly behind the center of the lens on what is called the visual axis. The fovea, which contains only cones, is a small depression in the macula, is the area for the best color vision. So basically, the rods and cons are divided. So different area or different names. Okay. So depending upon the area. Okay. So they have divided macula, lutea, fovea. So basically, the fovea, what will it will have best color detector. Okay. So an important cause of vision loss with people over 65 years of age is age-related muscular degeneration. Basically, what will happen? Degeneration will happen above 65 years. AMD, age-related muscular degeneration. AMD means age-related muscular degeneration. Loss of central vision and some cases seem to have genetic compound. So basically, some cases have genetic problems from their mother, father, or ancestors. They will get the disease. In the dry form of the AMD, small fatty deposit impairs circulation to the macula and cells die from lack of oxygen. In the wet form of AMD, so basically there are two types of AMD. We have dry form and wet form. So in the dry form, what will have whatever macula we have, the area which detect the color. Okay, so what will have not getting much amount of oxygen in that area. So what will happen? The area will die. Okay, likewise, in the wet AMD, what will happen? Abnormal blood vessels being leaking into the retina and cells in the macula die from the damaging effect of blood outside in vessels. The macula, the center of the visual field, is a part of the retina we use most for reading, for driving, for recognizing people, and for any kind of close work. People of all ages should be aware of this condition and that smoking and exposure to ultraviolet rays are risk factors. So here we are knowing about macula, very important for reading, driving, okay, and recognizing people means whatever the closest things we are observing. So with the help of macula, so it will damage. How it will damage? By the help of smoking. Okay, if a person smoke very uh, regularly, it will damage the macula, or exposure to the ultraviolet rays. It also damage the macula. When light strikes the retina, the rods and cones generate impulse. These impulses are carried by the ganglionic neurons, which all converge at the optic disc and pass through the wall of the eyeball as the optic nerve. There are no rods or cones in the optic disc, so this part of the retina is sometimes called the blind spot. We are not aware of blind spot in our field of vision, however, in part of because the eyes are constantly moving, in part because the brain fills in the blank spot to create a complete picture. So how the uh, late wave sweep pass? Here we have the uh, these are the cones and rods. Which these are the uh, 40. These are the receptors, and they are connected to the bipolar neurons. So they are connected to the ganglionic neurons. They are connected to the optic nerves. From the optic nerves, the area, some area is called blind spot. So what will happen when we close and open the eyes? What will happen? The blind spot we will observe, but always we are seeing everywhere. So like we are rotating our head and seeing sometimes constantly, continuously. So the blind picture will disappear. Okay, so the from this optic nerve it will reach to the visual field in the occipital region. Okay, so this is all about retina and other things related to the retina what we have to remember. Next we have cavity of the eyeball. What we have? Cavity of the eyeball.